Professor Nadine Ezzeddine. I hope I said that right. And she will be presenting, and her title is Students Need to Learn How to Think and Not What to Think, showcase from the Pathophysiology and Therapeutics courses. So Nadine, it's all yours.
Okay, I got this. Thank you, Audrey. Thank you, everyone, for attending. I guess I'm going to start sharing my slides.
I saw it earlier shared.
Yeah. Okay.
Yeah,
I
there you
thought
go.
I shared the wrong.
Yeah, no, I see.
So can you see my screen now?
Yeah, it's there.
Okay, one more thing. Okay, so the title, as Audrey said, I'm going to talk about. I think I'm going to introduce myself a little bit. I know most of the folks on the call, and I am an instructor at Dalhousie School of Nursing. I've been in this position full time for 5 years now. Yeah, and my courses that I teach are heavily since I started the Pathophysiology and Therapeutics course, which is what the course is called now. And I teach in the episodic course as well. Now, I knew I was the only presenter today, so I did not time myself. So let's see how we're. Okay, let's see. Okay, so just the outline. I'm going to talk a little bit of the background for where I reached this part in my teaching. I'm going to include the theories that I have been using and studying and explain a little bit what does logic of content mean, which is basically what the theory says. And then I'm going to talk a little bit about what we've been doing in the Pathophysiology and Therapeutic course at the Halifax campus with some outcomes. So some background. I've been teaching since 2005. As I said, I'm an internationally educated nurse. So in my country, Lebanon, I started teaching around 2005. I taught there for till I came to Canada, which was the end of 2015. And I used to teach microbiology for nurses and pediatrics. And I also used to go clinical with the students. Now, that was not the full-time job for me because I used to work in hospitals as well. Anyways, I came to Canada for the master's program at Dal and then worked 1 year in practice and then joined Dal as a full-time instructor, as I said, for 5 years now. I've had several observations over the years, but my observations through teaching early on at Dal was that students memorize content. They want to memorize lists, and they do not really focus on understanding what creates these lists. And it was obvious that students have challenges when they are asked to work with complex concepts. And the course that I teach, of course, I have co-professors, and the course is taught also at Yarmouth campus. It is a complex course. It's pathophysiology, which means everything that's going wrong in organs, and therapeutics, which means how does the pharmacological and non-pharmacological interventions help to alleviate these challenges. So our course it includes complex concepts, and that was challenging for students. It was clear from the very first day that students do not know how to study. And they come to my office all the time asking how to study. Two things were started to become clear is that even if they pass the course and even if they get a good grade from the course because they memorized and answered the questions, there were issues with retention of information. So they reach with me semester 5 where they are supposed to be using this information and applying it, and they're like blank faces when I tell them, remember when we took so. And of course, ability to apply this content in different contexts also follows the retention of information and adds to it the capacity to apply information. So these were my observations early on, and I'm very passionate about teaching and learning. And I was like, okay, let's see what we can do. So it was an unfolding journey for me, keeps unfolding and ongoing. from the very beginning, I love meeting with students one-on-one. I started doing that, and I still do it. And that helps me a lot to understand the challenges of the students, help me assess basically what are the difficulties that students are having. And then I thought, okay, I come with this idea in my mind. If students are not doing well, which means myself as a teacher is not doing a good job. So what I started doing is that I started teaching more and more. So I did a huge project on addressing the different learning styles of students, and I even wrote a publication with a group of co-teachers and students. Like, okay, let's present the very same material in different ways, in visual, read, write, and applications. So that took me some good work to gather all the videos for the students. Students found them helpful. In addition, I started tutoring the struggling students. So I scheduled weekly 2 hours with all these students that would fail the first quiz all through these semesters. And I would give review sessions for the students. So in other words, I was doing much more work than the students were doing. And I started as much as I can infusing active learning. And I was asking students, because I was doing all this work, I was hoping that I would achieve higher level thinking skills from my students. I asked them to analyze. I asked them to synthesize content. And I remember at that point, which was like probably 4 years ago, I started them to synthesize in a concept map, and that was a huge struggle. And I know that they were still struggling in spite of all the hard work that I was putting in, because I asked students for weekly reflections. So they still share what they are struggling. And that was not the answer. So me teaching more, trying to clarify things more was not the answer. So I still had the question in mind, how can I help students learn more effectively and learn critically? And with more meetings one-on-one, it became clear for me that students really need to understand that. I think that's imperative, right? They need to understand and think the content before and not memorize. And that when they think the content through, this thinking, the quality of this thinking should be a good thinking, which is, in other words, critical thinking. And sure enough, critical thinking is infused in our program. It's infused in all kinds of the literature out there in education and in nursing literature. However, it's really not as simple as it seems. It is a buzzword. However, there's a lot of inconsistency in defining the term. How to teach critical thinking, what would it incorporate, how to measure it. So the literature is confusing in that sense. So it started, I think my journey learning critical thinking started then. I've been studying critical thinking for 3 years now. It's been a long, and it's still an ongoing journey. I am still a student of the foundation of critical thinking and will continue to be. Long story short, it took me more than a year looking into different theories of critical thinking, and I finally found the Paul and Elder's critical thinking theory to be the most comprehensive theory, and it really answers, and it has answers to the struggles I'm finding in my classroom. So just to put it very simply, what Paul and Elder think about critical thinking. So basically break down the word, critical thinking. So thinking means reasoning. And critical comes from the word criteria. So when I'm thinking, when I'm reasoning, I should reason by abiding by certain criteria. And when I do that, I'm doing critical thinking. So that's very high level. What they do is that they present 4 conceptual sets in their critical thinking framework. They call them elements of reasoning, standards of thought, intellectual traits, and barriers to critical thinking. To put this together, what they really say is that when we think, any thought we have in mind, whether it's implicit or explicit, it has these elements. So when I think for a purpose. I use assumptions. And so if you just want to follow, actually, I have their quote here that says, if you still see, geez, one sec. Sorry for that. Okay, whenever we think for a purpose, which is basically here. We think for a purpose within a point of view based on assumptions. And this leads us to implications and consequences. We use concepts, ideas, and theories to interpret the data and facts and experiences to answer a question at issue and solve problems. So what they say is that these are the parts of our thought. When we are thinking, we are in a way or another covering these, having all these parts in our thought. However, that does not mean that our thought is critical. Anybody can have a purpose, can come up with conclusions, and can use information. But the information that we use, and from research we know the data that we use and information probably is not rigorous, is not relevant, it's not specific, it's not accurate. So in this case, it's not critical. So to ensure that when we engage in these elements, we are using the criteria to make it critical. They have identified these criteria, and these are the minimal criteria that should be found in our elements of thought to make it critical. So clarity, accuracy, precision, relevance, depth, breadth. Okay, that's the list. And what they say is that when I apply these standards to the elements of thought, patients with time and with internalizing this process, the human develops traits and dispositions of intellectual humility, autonomy, integrity, courage, perseverance. So that makes me a critical thinker along the line. In a specific setting, I can use the elements and standards, and this means I have thought critically in the moment. However, to embody that in different contexts in life, I develop the dispositions of a critical thinker. I'm going to stop because I can talk nonstop about the theory. And of course, going deeper in that theory, Paul presents theory of knowledge, learning, and literacy. So what Paul says, and I kind of pulled a few points of that theory that I have tried applying in my course. That students need to be taught how to think and not what to think. That's a conclusion I really reached for before I started reading Paul's theory. To learn content, one needs to learn the thinking that generated the content. I'll elaborate a little bit on this. And that learning does not occur by didactic, right? Transmitting information from one person to another, speaking to them. That's not learning. The educator's role is to facilitate the conditions that allows the students to learn for themselves. So they have to be self-learners by thinking things through. And educators should model the intellectual behavior they teach. And the last one, which is a little bit probably wordy, knowledge is systematic and holistic. That is, any content that we teach, it includes whole and parts. And to learn the content, the learner should engage in many cycles of breaking the content down into parts and then putting it back to make the whole. So it's this relationship between the parts of what we teach and the bigger picture. So learning details versus learning concepts. There is an interrelationship between them, and basically how we teach that is important. So to translate that, all of this, and into what I did into the course, this relationship between the parts and the whole and how things are interrelated to each other, they call it the logic of content. And just to make sure, just to be clear about this, from the philosophy part, there is an informal logic and formal logic. And here we're not talking formal logic, we're talking informal logic, which means that in this case, the logic is determined as a system of interrelated ideas that fit and align to make a system of meanings. In other words, logic is a set of interrelated ideas. They constitute, so these ideas, when they are presented in how they relate to each other, they constitute the content of the course I'm teaching, and this is what students need to learn. So what my role is to teach students how to think pathophysiologically. And if you notice, logic is inherent in the word. To think through the logic of patho. Pharmacologically, logic is inherent in the word. So how can I come up with the logic? And this is what an exercise I did, is to develop the logic of the course. Logic of the course is basically look at these elements of thought that we talked about, the elements of reasoning, because these are part of any content, right? These are elements, I'm repeating myself here. These are elements of when we think. Content, which is an article that I write or a book that I write, is an outcome of this thinking. And hence it contains these elements. So I looked into these elements and said, okay, how would the content of my course fit in this? How did the thinking of the people who came up with pathophysiology came along to generate this outcome, which is the content? So I have a document that analyzes across the 8 elements. However, I focused when I did my course on these elements in red, and how I presented them, that any presentation I have, any lecture I have, is categorized into these 5 elements: assumptions, information, concepts, inferences, and applications. And what would fall under each? Under assumptions, so again, to remind you, I'm teaching pathophysiology and therapeutics, pathophysiology pharmacology, which means I'm talking about a disease, an illness in a certain organ. So give an example. If I'm talking about a gastric ulcer, there is something that happens. If I say gastric ulcer, I'm assuming by default that I have a stomach. And the stomach has a certain structure, which is an anatomy, and the stomach has a certain physiologic functions that it has. So these are assumptions. It's everything that would come before the disease hits. And these are usually anatomy physiology courses that students take before they reach us, before they reach semester 3, where they start taking these courses. And then information means this stomach now, with its anatomy and physiology, is exposed to certain illness causing factors or risk factors. So in this specific condition, they need to know the causative risk factors. And then they need to start looking pathophysiologically, which means what is going wrong in the physiology and in the anatomy when the stomach is exposed to this bacteria, for example. So here we talk about pathophysiologic concepts, including infection, inflammation, and we go into details at the cellular level, what happens. And each steps, whatever is going wrong in the pathophysiology would lead to assessment findings. So it will have inferences, which are the assessment findings. When I have infection and inflammation in the stomach, and they know the cardinal signs of inflammation is pain, edema, and redness and heat, right? They start applying these concepts in the stomach, and they deduce the assessment findings in this way, rather than memorizing what happens if I have, for example, gastric ulcer. And after all this pathophysiology, and they include the assessment findings, they deduce the assessment findings because it falls under inferences. There are implications, which means what is by default going to happen because of this condition. So if I have a peptic ulcer, by default, there's a chance for complication. By default, in several conditions, my body is trying to compensate. And this gives me, if I know the pathophysiology and if I know the risk factors, as an implication, I can figure out how drugs can act to help. Like if I know that infection happens with a bacteria, I can give a medication that kills the bacteria. So before we start going into the pharmacology, we put on the board the pathophysiology that's happening and the causative factors. And okay, let's see now how we can stop this disease. And most of the time they come up with mechanisms of actions of the medications, which are very correct before we start the pharmacology aspect of it. So this is how this is also, so that's basically the logic of the content. As I said, I present it in my lectures, and I ask them to follow the same format to break down the content when they are studying. And again, as we said, because it's whole and part, they need, after they analyze, to synthesize, put things together. And I ask them to make a concept map. And this is a concept map for the course. And I'm sorry, when I copied this, it seems that I had overlap of certain boxes. So this is the same what I said. This is what happens. We have assumptions, we have anatomy and physiology and physiologic functions that are exposed to risk factors. And this would result in pathophysiologic processes happening. And these pathophysiologic processes would be manifested as these assessment findings. And we can have complications and compensations for the pathophysiologic findings. And the pathophysiology presents a very good place where we can deduce the mechanism of action of medications, and they relate the expected outcomes of the medications to the assessment findings. So to summarize how I present this logic in my class, it's my lectures. Every lecture, I don't have objectives as the sense of the objective. The objective is you need to analyze and synthesize the logic of this lecture, which is, and I put anatomy, physiology, put headings underneath, causative factors, put headings. So the outline, the objectives of each lecture it has the same headings. And the presentation itself has the same headings, which are these 5 categories. They have a case study weekly. And the case study that they need to do is analyze the logic and synthesize the logic, break down the content and build it up. And when I say analyze the logic, which means they need to break it down, into these 5 categories, and they need to write. They need to write in their own language, and they need to show clarity. Remember the criteria of critical thinking: clarity, relevance, depth, and breadth. That they need to have, and then they synthesize into a concept map. So they need to, and when they come to me always, how to study, I say, this is your method of study. So it's not meant to be a labor-intensive way to learn or to do an assignment. It's meant that it becomes their learning method. When they come and say, how do I study? This is how you study. Focus on clarity, logicalness, which is the relationship between these concepts, parts and whole, relevance, depth, and breadth. And I follow with weekly reflections after the case study for my students to see where they're struggling, to see what goes well or doesn't go well with them. Outcomes, I haven't done a rigorous knowledge translation for this as of yet, but I can share some quotes and I can share some outcomes. Generally, I'm going to say I have good attendance rate in my classes, whereas this is not the pattern at the school. Usually, on an average, I am with 3/4 the class. The minimum I can get would be 60% if they really have exams. So they attend, which means they really find value in this. My student evaluations are excellent. Like I range in my evaluations from the students between 4.7 to 5. There was one semester I had 5/5, which still means that in spite of the labor intensive, they are they like the approach. Students are happy. So this is a picture, and I'll show you why I did this. And there were other pictures, but I did not receive them with the students. I'm happy. I'm very happy. And why is that? Because the students actually, they made this sweater for me as a gift, and it says, what is the logic of it? And the image they chose actually is extremely representative of the idea. You see, it's the organs of the body, but it's the interrelationships, which is heavily what logic is. So we all love the logic of. I've brought some quotes from my students. And the quotes are fairly new. This is from the fall now, 2024. I want to say that I love doing this assignment for several reasons. Assignment is the case study where they need to analyze, and synthesize. Firstly, it challenged me to think in a way that I never have before. And thinking about the material this way is helping me retain the information I learned, which is basically one of the challenges and goals that I wanted to achieve. I found it frustrating, of course, because it's not something I'm used to. I admit I used to cram, but I feel like I have a whole new understanding on hematology and anemias after struggling through it, and the case study was on anemia. Also, I feel like thinking about the information in this logic format will be so useful during nursing practice. So I'm seeing somebody who feels that they can take this knowledge into different contexts. I found it challenging to stop the concept map. I kept wanting to making links and connections. That's all I want them to do, make links and connections, but felt it was starting to get messy and I wanted to stay on the information relevant to the case at hand. Overall, regardless of how I did, this is one of my favorite assignments I have worked on, and I'm looking forward to the one next semester. Let's pick another quote. I appreciate the opportunity to learn how to learn. My first degree, I do not remember a prof specifically taking the time to help their students learn to logically consolidate knowledge and navigate what could be an overwhelming amount of information. I found that the assignment made me delve into the material much more to really learn about the concept. So here they're learning in depth. I loved this. I got it an email from a student, and I'll read it for you. I really enjoyed your class this semester. I have learned so much and have applied what you have taught me in other classes. And I was above the clouds when I saw that. For example, in my clinical integration class, I got 89% on my case study because all of the knowledge I have applied to that assignment was from the things that you have taught me. I was really proud because my lab instructor said that my paper read like an academic paper. And this is prejudice, this is biased, which I hope that any approach I'm using is really helping the students to internalize a way of studying. However, I got an email from a student who passed the NCLEX this summer. I'm excited to share that I passed my NCLEX. Your guidance has been instrumental in helping me achieve my goals. I truly couldn't have done this without you building the foundation. Now, I don't take the credit for myself. I have co-professors and tutorial leads. We all work as a team in this. So future steps. I am focusing more on more active and independent learning methods. Now, I talked heavily in this, what is logic and how to incorporate it, how to the teaching methods of critical thinking is also, it can be another presentation, but I'm focusing more and more on this active independent learning. I'm doing less work with the students. I stopped giving the review sessions and the specific tutoring sessions. As Dr. Elder, because I'm a student of Dr. Elder's, told me, if you're doing more work than the students, which means you are learning and they are not. You're the one doing the learning. And I'm doing less of these sessions. And I am really pushing my students out of their comfort zone with more independent learning on their own. Of course, we're always available to support and guide. And they're not resistant to it. They're not resistant to it. And these are the goals that I shared from pushing them more through the uncomfortable zone. And I tell them often, learning is painful. It's not like it is hard work. It's painful. The outcome of learning is the beauty of it. When you have that fit mind, that logical thinking is when you can feel so proud of yourself. I do have a plan to present this work as a knowledge translation project. We'll see how I can work around that. And I have been, and I will try to do my best to utilize more of the tools of critical thinking theory in different contexts, not just the logic, but kind of bring it through other courses and different assignments, different kinds of assignments. These are few references, and I think my presentation is done. And I'm happy to take questions.
Thank you, Nadine. That was a very interesting presentation. And I actually learned quite a bit from your presentation, and I find it very fascinating. And I think the application of this can really be utilized for everything. It's not just for undergraduate students. I see this also with our graduate students as well, because the struggles we see in the undergraduate students doesn't stop with the undergraduate program. It continues on. And I have a couple of questions, and I'm sure there's going to be tons more after, but
Before, am
I'll,
I still
yeah,
sharing? Sorry, am I still sharing?
no, no, you're not.
Okay,
It's all
okay,
done. Yeah.
okay,
So I have a couple questions for you.
sure.
One, do you feel so the theory, the critical thinking theory, because you now have looked into this and you have I think I feel like you have a very solid understanding of the theory. Can it be applied at any stage of learning? So, for example, we have no control what those undergraduate students that come right out of high school, we don't really have any control of what their education or what type of education they received from high school. And it'd be interesting actually to map out how this actually works at the high school level, because that's the basis we get. Can it be applied in any situation? So it doesn't matter. So it's not pending what they present with from high school. And the same, for example, our advanced standing students that come in with a previous degree. And the same can be with our graduate students who already are nurses. So can that be, it doesn't matter what the background context is, it can be applied. So that's my first. And the second is, do you feel that, I agree with you that critical thinking is such a buzzword that we use it so much sometimes that it almost goes on like deaf ears, because when you use it and say it so many times, the students kind of roll their eyes at you like, oh God, if I hear that word one more time. I feel like maybe we've focused so much on critical thinking on the application of the content that they learn that we haven't really thought about it in the learning process. So you are really focusing on how students learn and how to learn the content, not how to apply the content, which which really could explain perhaps how that critical thinking it is not as effective as we'd like it to see, because they haven't really learned the content yet. So how do you apply content with a critical thinking lens when you haven't really learned it? Because we all know the cramming and memorizing, it's like any of us, you just don't retain it, like it's gone, right? So I'll start off with those two, and then I see some hands up, so I won't
Yeah,
monopolize your time.
yeah. I'll just give a little bit about my background in this theory. As I said, it's been 3 years for me. So the Foundation for Critical Thinking in the States, which is the House of Paul and Elder Theory. I've been a student with them for 3 years. I got certified first level after studying for 2 years. And I'm a student of Dr. Elder because Dr. Paul passed away. I'm a student of Dr. Elder. We meet every 2 weeks. So it's an ongoing journey. It's a requirement to maintain my certification. Yes, I have been doing this. I looked into other theories. Actually, at the moment, I am involved in doing a comparison between, which I did in the past. I did my one, I was at one point student PhD. I did a comparison between critical thinking theories in medicine, nursing, and the generic ones. So to wrap this up, this theory is a generic theory. Unlike nursing, clinical judgment models that we have in nursing, which only applies to nursing, this is a generic theory. Generic theory means it applies everywhere in any context. And as you saw, the language is simple. That was one of the criteria they have. So it can be applied in the undergrad. It can be applied in the graduate. In their website, they have resources for kindergarten. They have specific books for kindergarten. This is where, you need to start. And they say they can, and there's a lot of logic in it. And to the school system, into everywhere. Now, is it applied in school system? No. No, that's a problem. I know because I work with them certain schools in the States that have adopted this model and applied it at the school level, very minimal. I know of very few universities that have tried their model. The University of Louisville, they have took this as a quality improvement project and implemented the theory across the board in all programs, engineering, nursing, everything. It's very successful. at that level. The best way to introduce it, I would say, for us is to have a course on critical thinking very early on in the program, and then to infuse it throughout. It means each course is structured around the logic of the course, which aligns very much with the concept-based learning. These complement each other. And then we go through, as I said, the more you internalize these tools, the more they become part of the person you are. I'll tell you frankly, Audrey, using this theory in my personal life, analyzing the struggles as I have, has been a very much help for me mentally, much better than any mental help I had through these things. So it can be applied. It needs rigorous work. Absolutely. It's not an easy theory. After all, critical thinking doesn't mean I need to think simply. The other question you had, remind me the second question.
Well, it was more like, could it be why our students struggle applying critical theory because of
I think, yeah, that's very interesting. I think Bloom's taxonomy, it was very much popular. It's very much popular. We are asked, actually, even at Dal, to structure our objective around the Bloom's taxonomy. The problem with Bloom's taxonomy, it starts with knowledge and then comprehension. And that's kind of contradictory to what I was saying here, because I cannot know something if I don't understand it, which means I am memorizing. That's what they're saying. And Bloom is asking me to memorize without understanding. And I think that's probably why we were so much emphasizing. And then we say applying. Anybody can apply. Like anybody can come to me and say, okay, I'm applying this knowledge in this context now, and I'm doing this. This doesn't mean that it involves critical thinking because they didn't use the relevant and accurate information, for example. They're not clear on the steps. So what I'm saying here is this theory, and I love this theory because it differentiates between cognitive functions. So application, synthesis, analyzing is a cognitive function we can do. It's of a critical nature when I apply the critical standards to it. And I think this is the disjuncture that happened in higher education. And again, another push was with big classes, we needed didactic learning. So it was the easiest thing to tell students, memorize, right, in that sense. So I hope I answered your questions.
You did. Thank you. I see Megan first there.
Oh, can you see me? I can't see what's going on. Okay, great. Thanks, Nadine. This is really exciting work, and congratulations. Obviously, the students are very excited to take your class and are learning. I guess I sort of have a question and a comment. Number one, have you published this yet?
Not yet. No,
okay.
No. I'm planning for a rigorous knowledge translation action to not. I'm planning for a rigorous study on this, and then
Okay, yeah, and just so I mean, it's great work, so it needs to get out there and to be shared. But just thinking about how to share that within our School of Nursing. I remember like 15 years ago when we were teaching the community course, we would use the Kolb's action reflection model and talking about critical thinking. I know we've been doing this for a long time and trying to figure out what's the best way and how can we do this, and we were using journaling a lot back then too. So I'm not sure where that's gone because I'm not teaching in that course anymore, but being able to take it to this level. So your example of taking the model, the concept mapping, and really applying it. And so that's the big question, how do we implement that? So it'd be really great to, have you publish it, number one, but also I love your idea. How can we get together? So I know the undergrad program has the monthly meetings, but also the graduate program. How can we come together to talk about critical thinking, what that means, and if this is a model that we could all, adopt and use somehow to have that consistency. I hear that's what you're suggesting to do. So I guess I'm just saying I think that's a great idea, because many of us do struggle with this. We all throw around that term critical thinking. You need to be critical thinkers, and we're probably addressing it in different ways in each of our programs, in each of our courses. So I think we're all trying to do that, but it would be great to have a conversation and come together to do that. So thank you so much.
Yeah, it is challenging. I just want to comment because the theorists themselves, so there are still two who are still alive. At one point, they reached out for, they are in the States, so they reached out for the nursing licensure bodies there, and there was a resistance because the answer they got was, we have a nursing process. And I personally do not believe that the nursing process is a substitute, because if I do assessment, I need to be thinking critically when I assess.
Right.
Diagnosis is a judgment, and I need to be thinking critically. So they complement each other, but nursing process does not substitute critical thinking.
Yeah.
Now, I mean, I can do a presentation on its own about critical thinking, the terms clinical thinking, clinical reasoning, clinical judgment in nursing. There's a lot of confusing literature out there.
Yeah.
There's inconsistency for sure.
Yeah. Oh, excited to continue talking about it. Thank you.
You're welcome.
Elaine?
Thanks, Nadine. I co-teach with Nadine, so I have been following along on this path, and it's been really valuable. So what I was thinking about while you were talking were the intellectual standards and the intellectual traits. And I do see a lot of parallels with like nursing theories and, a lot of the work I think we're trying to do, especially in teaching, supporting students to become nurses. And I agree, critical thinking is a term that's overused as well. But in terms of the intellectual standards and intellectual traits, a question, oversimplified question, how do you incorporate that in your teaching? And then is there an opportunity? I think a lot about like metacognitive processes for students. So how students understand their own learning needs, how they understand what they're doing in class, and how it's going to apply to their knowledge, their practice as a nurse, that type of thing. So how can we support students to understand that they are engaging in learning critical thinking in the classes? And is Megan mentioned like reflection and journaling, is that something that we could incorporate in a course like pathophysiology and pharmacology?
Yeah. Well, there are so many parts of your question, and sadly, I don't have a pen next to me to write the points. So I'll try to answer.
I'll put them in the chat.
If I miss anything, just let me know. So first, metacognition. Paul, the way he defines critical thinking, there are several definitions, but the simplest that he used is thinking about your thinking as you're thinking to make your thinking better. Metacognition is thinking about your thinking, right? There are no criteria. It doesn't include the criteria that make it critical in the sense of that sense. Now, Ennis defines critical thinking as reflective thinking, and it is adopted by the foundation. So reflection is core for critical thinking. The idea is that what am I reflecting on? Right, so students can put things, I guide them with questions because I need specific questions. It's the, as Paul says it, you need a substantive concept of education when you choose any teaching or learning method. So if reflection is one of the learning methods you're using, it's that exactly what are they reflecting on? Are they reflecting in their struggles under assumptions? Are they reflecting on their struggles under analysis, for example, the data or whatever? So we need to guide them to really reflect, which means look into what they have done and what they have worked on, and measure that through the criteria. So how do I incorporate it? This time around, I incorporated the standards in the rubric. So yes, I work with Elaine. So we used to have that, the rubrics for their case analysis with that. Okay, this is the analysis part. You need to do this, 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 and this is the concept map. You need to do this, this. So now I incorporated, okay, you need to show us clarity. You need to show this level of depth. You need to show this level of depth. And this is the recommendation. It's criteria. That's what they are, the standards. And then we need to evaluate our students based on this criteria. And it's not something we really do not do, if that relates to your question. I remember when I was a student in the master's with Sherry, she would say, this is vague. So she's asking me for clarity. This is not complete. So she's asking more for, sometimes she asks for significance. Why did you put this? So there are feedbacks that we got from our professors all through that includes these criteria, probably not structured in the way that the foundation structures their rubric. And the foundation does have on their website actually rubrics ready if anybody wants to use them or modify them, whatever it is. Is there any part that I haven't answered yet? I think there is, but I can't remember.
No, well, that was great. I'm really happy to hear that you did that with the rubric. Can't wait to see it.
Yeah. And, I'm just putting it out there. So for clarity, and I started using it, they use the SEEI. So state, elaborate, exemplify, and illustrate. So that's what I was asking the student. When you say something, okay, say the statement. In other words, it means this. Just for example, and you give an example, and this completes shows the clarity for certain things. So there are these tools that are helpful. So back to you, Audrey. They do provide. Actually, I took a course with them, which was critical writing. How to design the logic of your paper before you start writing. And I remember when you taught me very early on, you said, I write an outline of my paper before starting writing. So you're implementing this in your own way. They just probably have it a more structured manner. Yeah.
Well, thank you, Nadine. And Andrea.
Hi, Nadine, thank you so much. This is really fascinating. I just love it. And I'm just looking at it from chairing the curriculum committee. So obviously you've given beautiful examples. And so I'm just, wondering how could we actually try to implement this across the curriculum? So I'm looking at courses that are, pathophysiology is fairly concrete and follows the biomedical model. So I'm wondering what are your thoughts around using that approach for some of our courses where we talk about abstract concepts such as health equity, social justice in the community course that Megan has mentioned, or now we're having a new course in semester 7 starting with a big title, Social Responsibility, Professional Reasoning in Social Responsibility. So, or even like, how would we use this to teach empathy, like, emotional intelligence? Like, how do you see that we could adopt that approach across the curriculum as nursing the art and the science kind of piece?
Yeah, it's definitely a big project. It requires, I would say it definitely needs building capacity among faculty preparing the courses. So they need to understand the theory, that's for sure. And the second thing is that logic means whoever came up with this science, be it a medical science, be it a social science, thought in a certain process, thought in a certain way, and that's the logic. We just need to paint it out there. And the biggest literature on this theory actually comes from English and history and politics. So definitely there is a lot to be done. I have also an engineering and math everywhere. For empathy, actually, I'm going to speak a little bit about this. I'm not sure if Colleen is in the call. Last semester, Colleen and myself, we revamped the paper for 3710, and we're specifically asking students to practice intellectual empathy. So that's what the theory says. It's called intellectual empathy and intellectual humility. And intellectual empathy is different than the empathy or cultural empathy that, the literature talks about. Intellectual empathy means your capacity to adopt the point of view of the other person and reason through their point of view. Doesn't mean you are accepting what they're saying. It doesn't mean you agree with everything they're saying, but trying to see things and reason through these elements and apply these criteria through their point of view. So what happened this time around, we asked students to select a marginalized population and to write their assumptions about the health behavior of this population without reference to anything. That was first week. And then we ask them to go and dig into the literature and look into their the health promotion, disease prevention, because that's what it is. And then to come back and assess their assumptions, the biases, using if it's logical, if it's relevant, if it's fair. So that's one of the criteria. And it was a very, very interesting paper. Also, hoping we can publish at one point. It was an amazing paper looking at the assumptions and the biases the students had. Oh, some of them struggled a lot because most of these assumptions and biases, they function at the unconscious level. That's assumptions. And to dig them out and bring them out was a struggle. We had lots of meetings with these students and kind of navigating around. So long story short, the foundation provides guiding questions to dig out the assumptions and guiding questions to assess for relevance, to assess for fairness, to assess for, so they have lots of tools out there. Yes, it can be applied. We already applied it. We presented that assignment actually at Kazan last July, I think it was, or May. Yeah.
Yeah, that sounds fascinating. I'd be interested in, we need to meet because we're running out of time. But I think what we could do, look at the assignment, because I think that was with semester 6 students. Five or six. But yeah. I would love to look at this assignment, and then how do we level that up to semester 7, for example?
So what we can do if we create a project, as I said, we need a course early on so that they understand the elements and how to apply. And then we start and pick and choose certain traits that we want them to practice at each level, and which criteria we want them to focus on, which standards we want them to focus on. And we level and scaffold. We can do that structure. Like if we only work on assignment base before going into, doing the logic of each course, because the logic is going to take a lot of time. It took me quite some time, actually. I think I'm privileged because I connect with the foundation, and I bounce ideas. What do you think? I'm on the right track here? Yeah.
Fascinating. Lots of work. We need to talk. Thanks.
And I think we have just time for one more, and Shauna, you're on.
I no questions, just a comment. And I had the absolute pleasure, Nadine, to co-teach with you for a number of years as you started this journey. And I do have to put a plug in, was the recipient of the Faculty of Health Teaching Excellence Award last year. And really, that's the fruits of all your labor that you've put into studying and, learning and trying to understand how students learn and what our best approaches are. And to building on what Andrea said in regards to curriculum, we do need to add this to the agenda and talk about it at our one of our curriculum meetings on what we can look at across the curriculum, because there's a reason why the attendance is so high in the class, and very much related to the tools I think that you provide to really encourage students to own their learning by providing active learning strategies in, the classes, and giving them frameworks to use. So anyway, that's all I had to say.
Yeah.
We have still a few minutes. Melanie, did you have a question or a comment? But we do have a few more minutes, Melanie, if you wanted to ask something, because I see your hand up.
Yeah, I know we're short on time, and I just wanted to just a comment, because a lot of my questions were actually answered during the question and answer period. But I teach the Patho and Therapeutics in Yarmouth and have worked with Nadine in the past. And Nadine, I found this presentation very enlightening. I learned a lot from this presentation. I appreciate you sharing this with us. And I think we do need to have some conversations between Halifax and Yarmouth in the future. So I really look forward to that. And the last thing I'll say is that I'm really jealous that I don't have one of those T-shirts.
I wear them first day, so that other cohorts, when they come, I make a show and I wear this sweater and I'm like, you see this? This is gonna be your you're gonna learn logic of as your name from now on. Did I get your attention? Do you know that the term is important? So yeah.
It's absolutely amazing. And thank you very much for sharing this with us today. Really appreciate it.
Melanie. Thank you, Melanie.
Shauna? Oh, you did. Oh, your hand is up. Was that just by mistake? Okay, perfect. All right. Well, Nadine, very informative, and you have a very great attendance in your presentation too. So that's something right there, right? Thank you so much. Excellent work. I agree with Megan. It needs to get out there because, I mean, I know you do this out of passion, but it's also, it would be fantastic just for others to see the hard work you've put in and also be able to utilize. So thank you very much. I'm glad there were no other presenters because you absolutely needed an hour for all this. So thanks again, and look forward to other bits of your work as it comes through.
Thank you all.
Thanks everyone. Have a great rest of your day. Bye-bye.